As an expansion of the successful restorative policing program, the police department has begun working with the court system, healthcare providers, jail, and social service agencies to create the Restorative Court program. This program allows officers to develop customized recovery plans based on the needs of each individual, to encourage healthy lifestyles and keep people out of the cycle of homelessness.
Typically what will happen is someone will be arrested for drunk and disorderly and will wake up in jail and decide that they're done with that and they want to change their life. And their attorney or Officer Hove will admit them into the restorative court, and then they are committed. They have to sign an agreement to stay with us. They have to sign an agreement that says they'll follow the case management plan, and the case management plan will be designed to deal with any substance abuse issues, mental health issues, and get them into stable housing.
The program has helped many individuals gain control of their life once again.
Were you part of Restorative Court?
Yeah.
And tell me about Restorative Court.
You got to show up whenever they give you on Wednesday at 11. You have to show up and see the judge, you know. And I had a public defender, you know, and I was doing it once a week, and then it was every other week, and then it was like once a month. So it paid off. I got through it all.
Do you think you're better with Restorative Court or worse with Restorative Court?
It was good.
It was a good thing?
Yeah.
And what's your...
I haven't got any tickets since I've been sober, so...
That's what it's all about. And before, you had a lot of police contact, right? Before?
Well, because I was homeless and living in the park.
In the park. So with Restorative Court and where you are now, is your quality of life is improved?
It has, yeah. I don't miss drinking one bit.
That's huge.
Yeah.
The nature of addiction is that when you have people that have been abusing substances for 30 years, they're probably not going to make it their first try. And all that we ask is that they keep working with us and that they keep trying. And we have a man in right now that's probably on his 4th try, but he still wants to do it and he is still willing to try, so we're willing to work with him.
Without encouragement, support, and a personal desire to change, people will almost always fall back into their old patterns.
If they fail to complete the program as it's described for them, we send them back to the Alpha Court. That means they had several months to do the right thing, and they choose at some point to go, you know what, this is not worth it to me. I'd rather just go spend 2 weeks in jail.
Booking the homeless in jail impacts the current overcrowding of our jail system.
We do have a lot of the same people coming in. Anecdotally, about 80% of the people that we book here have been booked here before, or we have some sort of prior relationship with them. We actually release them pretty quickly. All misdemeanors we release on a citation to appear, which is like a ticket to go to court. So we don't really have the room in our jail to house very short-term, low-level offenders. That's because we don't have the jail space.
In addition to prisons, businesses, and police services, emergency rooms and healthcare services are also heavily affected by this issue. In the last year, Cottage Hospital had 220 emergency room visits and 290 hospitalizations of homeless individuals, costing approximately $2 million.
If you don't have a regular care provider and if you don't have regular resources to medications, then that'll cause a breakdown in preventive health and subsequently can cause disastrous situations which will lead to hospitalizations.
The more services that can be delivered to the homeless in an efficient and cost-effective manner, the more time is freed up for better customer service to the entire community.
But our ultimate goal is to reduce calls for service for our first responders, police, fire, paramedics. We want to reduce the amount of beds that are used at Cottage Hospital and out at County Jail. In doing so, there's a huge cost savings that the community will recognize. It's not an easy process, and it's not always timely. And simply because we're never in charge of when somebody makes the decision to change their lifestyle. But being omnipresent in the community, always being available when they are ready, is what's making our program really helpful.